A few years ago, healthcare organizations discovered leadership rounding. We certainly didn't invent it. If you look back at Hewlett and Packard in the 60s, they called it management by walking around. And if you're a lean guru, you call it going to the Gemba. I think what we really could call it is going to where the work really happens and having meaningful conversations with the people that we work with and with the patients that we serve. Wonderful things can happen when you're out rounding and talking to patients. I remember a few years ago, I was in an acute rehab hospital rounding on patients, and there was a lovely lady in her late 80s, early 90s, who was in a wheelchair outside of her room waiting to go to the gym. I came up, introduced myself, explained why I wanted to talk to her, and asked if she'd mind to chat for a few minutes, and she said, of course. So I try to practice what I preach, so I like to get down at the same level as the person that I'm talking with, so I squatted down because she was in the wheelchair. Now the only problem is with my knees, that doesn't last for very long, so I tried to inconspicuously pull one leg back and kneel on one of my knees, but she noticed. And she stopped what she was saying, and with a little mischievous twinkle in her eyes, she said, "Are you going to propose to me?" Still makes me smile when I tell that story today. It made my day. It made my week. And I hope it brightened her day a little bit too. Incredible things happen when you go out and have meaningful conversations with your team and with patients. It's a powerful way not only to influence the culture of your organization, but to reconnect with the reason that all of us got into healthcare in the first place.
Meaningful conversations with patients and staff during leadership rounding can be a springboard for better results. Learn more at stampandchase.com.